Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. As always, trying my level best to provide you the best OET coaching. And today we are going to discuss this role play that you guys have asked me. I have completely no idea. I have no clue about it. What difficulty is this role play? So I will try to start it from scratch. As in the exam, I will get 3 minutes to prepare. So now my 3 minutes are starting now. Okay. Emergency department of a large city hospital. Okay, one point that there is emergency department. A 32-year-old vehicle accident victim. The driver of the vehicle. Okay, the driver of the vehicle has been brought in the emergency. Just a second. It's just because of yeah, brought has been brought means it's a passive voice that the driver of the vehicle, who is 32-year-old, suspected broken arm and concussion from the accident. The patient also appears moderately drunk. Who is patient? Is it the driver or is it the patient? So it's confusing. It is midnight on a Saturday. Driver of the vehicle has been brought. So I think this by chance has been given wrong. It should be a 32-year-old vehicle accident victim. The driver of the vehicle. I think driver is the patient. So yeah, because it is given in coma, so there is no point of making it wrong. So victim is the driver, has been brought to the emergency department. It is mid and the patient also appears. That means driver appears moderately drunk. It is midnight on a Saturday night and the ward doctors are very busy attending to many other patients, including the victims of the vehicle accidents, bashings and drug overdoses. So that means it's a Saturday night. That means on Saturday nights, usually in the foreign countries, people celebrate a lot. So they are saying including the victims of the vehicle accidents. So on that day, maybe there are many accidents, bashings and drug overdoses. It's common thing maybe happening in some country. You are trying to assess the patient's injury before further treatment. So I'm a nurse. I'm trying to assess patient's injury, whether it is severe, it is mild. So that is my duty. So that I can tell doctor, oh sir, it is critical. Please come here. So that is what we being a nurse must be doing. Ask the patient what she remembers about the accident. So first of all, my questions would be good morning. My name is Bhupesh. I'm a nurse over here. So I have been told by the doctor to assess your injury. So could you please tell me first, like how did this accident happen? Can you remember anything about the accident? So that is the first question. Tell the patient that you have no information about the other passengers in the car. So maybe the driver will say, oh, I was driving the car and we all were moderately drunk. Driver doesn't mean necessarily driver. Driver means the person who was driving the car, so it doesn't mean driver. So you don't have to take it that way. Even I took it that way, but now I'm understanding driver does not necessarily means driver. Means the person who is driving is also driver. So he must be asking about the friends. So you can say that I don't know about your anybody about the other passengers. You are the one who has been assigned to me. Passive voice. You are the one who has been assigned to me. Has been assigned means assigned by the protocol, by the doctors to me. The most important thing for now is for her vital signs to be checked. So right now the main thing that I have to do as told by the doctors is to check your vitals and for him to be made comfortable while waiting for the doctor. And by that time I am available for you, because I can't directly say that I have been told to make you comfortable until the doctor comes. So I won't express that way. I will keep the patient engaged. I will ask about the vital signs. I will check the pulse. I will ask how did this accident happen. How did this accident happen? Did comes with first form. Did happen. Refuse the patient the use of phone asked for. The patient's mobile phone is missing. Refuse the patient the use of a phone asked for. Okay, so maybe the patient is asking for the phone. So you can say, sorry, you are not allowed to use the phone in the emergency department. I'm sorry, as per the hospital protocol, there are other patients who might get disturbed. So I'm afraid to say, I'm sorry to say. When you are saying anything objectionable that can be objectioned, so in that case you have to be, I'm really sorry, I'm sorry, I'm afraid to say you can't do this thing. So you can use any of these things. Then deal with the patient's other concerns while encouraging him to be positive and to be relaxed. So do you have any other concerns? Be sympathetic but firm. So you have to be very sympathetic that I understand that you have gone through a very bad accident, and I understand that your mobile phone is missing, but we don't have any idea about the mobile phone. But at the same time, stay firm that these are the orders you need to follow. Give the patient some encouraging words to end the conversation as you prepare to take his vitals. So means by the time patient is talking to you, so you can say that I have examined you and everything is looking fine, and now I want to check your vitals. Okay. So yeah, the role play is not very much up to the mark because the patient has come to a large city hospital. So let's see how it go. But in this kind of a role play, obviously patient will play a huge role. So when you are a nurse, in this kind of a role play, you have to be dependent upon the patient. And yeah, good morning. My name is Bhupesh. I am a nurse over here, and we are the nurses in this emergency department. Now, doctor has assigned me a duty to check your injury, to assess your injury, that whether it is mild, moderate. But before that, I would like to know how did this accident happen? Well, nurse, I don't know. Maybe I was driving the car. We and my friend had some party as it was a Saturday night, and then we met with an accident and this and that happened. Okay, but I want to see the doctor. Well, then being a nurse, you will say, of course I understand that you want to see the doctor. Doctor has already been informed that you are here, and doctor has told me to check your vitals and to assess your injury. So could you please tell me how did this happen? Well, nurse, I don't know how did this happen. I have already told you I was drunk. Where are my other friends? Well, I'm afraid to say I have no idea about your friends. You have been assigned to me, and doctor has told me to again check your vitals. That is the most important thing for now, because if I will check these vitals, these are the vitals. After recording, I will give it to doctor, and doctor would be able to give you a better treatment and will be able to make a diagnosis. But at this moment, checking your vitals are very, very important. And please be relaxed. You don't have to worry about anything. We all are here to support you. We have got a huge team of nursing staff and doctors who are here to help you. So there is nothing to worry. But nurse, I don't care. I don't care about your team. I don't care about anything. I just want my friends. I need my phone. I don't know where is my phone. My phone is missing. Have you seen my phone? Well, I'm really sorry. I don't know about your phone as well. Maybe that would be over the counter or maybe in the OPD, but you are now in the emergency department. Over here, phones are not allowed. And you were moderately drunk when you were brought, and you have a suspected broken arm. So I need to assess your injury as it is very, very important. And also you are having some concussions from the accident. So maybe you don't remember, but you actually were driving, and you have been found to be moderately drunk. So in these cases, obviously we have to take care of you, and recording the vital is very important. So if you don't mind, can I please assess your vitals? Well, nurse, okay, then you can assess my vitals, but I really need a doctor. Well, of course, doctor is coming soon. He would be able to address every problem of yours, and you don't have to worry about anything. And is there any other concern that you are having? Well, yes, nurse, I'm having a huge pain in my arm, and I'm feeling some pain over the head. Well, I can understand that, as I have already told you that maybe your arm has got banged into something, or maybe you tripped over something, so your arm is suspected to be broken. I'm really afraid, I'm really sorry to tell you about these things. For that, obviously doctor will give you will actually tell you or advise you for an x-ray, as only after the x-ray we can get to know whether there is a serious injury or it is a moderate injury. So doctor would be coming here very soon, and he would be taking care of you and would be examining you nicely and thoroughly. Well, nurse, then what are you here for? Well, I have already told you that I am here to check your vitals because doctor is coming soon. So as soon as doctor will come, I will hand over your vitals to the doctor, and then doctor will examine you and will make the diagnosis, and also will help you or advise you for any of the suggestions or any of the x-rays or anything that you need after this. So are you okay? Can I check your vitals? Yes, nurse, okay, you can check your vitals. And again, I would tell you that obviously I understand this injury must have hurt you not only physically but mentally, but there is nothing to worry. We all are here to help you, And as you can see, there are many other patients. So that's why doctor is busy, but he's coming very soon. So by that time, I will record your vitals and we all are here to help you. Is that all right? Okay, nurse. That is how you do this role play. These role plays are tough. Obviously, there is lot of information that was missing. So it was little tough for me as well. But that is how you execute these kind of role plays. Have you all understood? I'm just gonna unmute you because this role play is little cumbersome. I can understand you must have gone through a little hard time when it comes to these kind of role plays. In the exam, obviously examiner will be there to support you. Examiner means he will act as a patient. He will tell you this happened, that happened. But in particular, do you have anything to ask in this role play? Anything in particular that you want to ask, guys? Anything in particular? It was
Sir,
it was a tough role play for sure. Yes, Navjot ma'am.
sir, like this whole role play is mostly depend on patient's questions. If he asked, then we will answer. But what if he don't ask, like if about mobile phone
I'm
or
I'm afraid to say, or examiner OET interlocutors are really reluctant. But in these kind of role plays, he can't be reluctant. Obviously, he has to talk about something. Otherwise, I will not talk about this phone missing role play. Otherwise, I will not talk about it. But again, this cannot happen in the exam. That's why I'm saying it's little bit of a cumbersome role play. Yes, examiner will definitely be angry upon you. That is for sure. Oh, nurse, I don't care. I just want to see the doctor. I want the doctor. Then you say, please calm down and relax. I understand that you want to see a doctor and it has already been informed to doctor. But as you can see that there are a lot of patients over here. So doctor is little busy. But yes, first of all, I will record your vitals and straight away I would call the doctor. So doctor is coming very soon. It's a protocol that we are following, that first of all I need to assess your vitals. I will report the vitals, then doctor will be able to help you with your diagnosis as well as the treatment part, or if there is any investigation that is required. So that is how the things will go, Navjot ma'am.
okay,
Obviously,
sir.
obviously patient will ask for the phone. Obviously then you will talk about the phone, otherwise you won't be talking about the phone.
Yes, sir. Thank you.
Not a problem. Any other question by anyone, please? Any other question, please? And comfortable means you don't say that, oh, I'm here to make you comfortable. No, no, no. So you said, don't worry. We all are here to help you and to assist you. And there is nothing to worry. We are the trained nurses and we have an expert team of doctors. So we will be taking care of you in the best possible way. There is nothing to worry. Do you have any questions? And when you will be asking about, are there any concerns? Maybe he will talk about the arm, something else. Then you can say, yes, I'm sorry to say, but yes, you are suspected with a broken arm. As we can see, there is an injury and there is concussion as well. So yes, that is why an investigation, maybe an x-ray would be required. But at this moment, waiting for the doctor is the right thing. He is just on his round. He would be coming to you very soon, and if required, he will definitely recommend an x-ray to you. So that is how you speak in the flow. And if you can see, when I did this role play, when I was reading it, my flow was not that good because I was thinking as well as I was speaking. So that is why you get 3 minutes so that you can write the important points. Then the second important thing, if you will realize, now my English is becoming more fluent. Even though I consider myself an expert of speaking, I've scored 8.5 in IELTS out of 9. I don't know why the 0.5 was not given, but that is not the scene. The main thing is that my fluency is really good, but still when I have not spoken English since morning, my English is like little haywire. But now my English is coming back to track because now I have practiced. What I mean by this statement, in the OET exam, in the final exam, what you do after your writing is very, very important. So after your writing test is over, you get free, you get the lunch in OET. In that duration, please try to speak in English. Till the time you do not complete your speaking exam, keep talking only in English. People talk in Punjabi. What is the topic, or Hindi? What topic kya aaya tha? Topic kya aaya tha? It will not make any sense. If you want to ask anybody, first of all, do not ask anybody about the topic because it confuses you. Second, if by chance you are talking to anybody, then please talk in English. That is what flows us. Now, after speaking English, now you will see the flow in my language. Now, let me complete the role play again. Good morning. My name is Bhupesh. I am a nurse over here in this emergency department. So, doctor has told me to examine you and to record your vitals. So, I hope you are all right at this moment. Are you feeling any kind of pain? Oh, well, nurse, I'm feeling pain in my arm. I'm feeling okay. Let me examine you. And at the same time, as I have already told you, I am here to record your vitals. I hope you don't mind that. Well, no, nurse, I'm fine with it. Okay, so could you please tell me your name? My name is John. Okay, Mr. John, thank you for allowing me to check your vitals. And could you please tell me, can you remember anything from your accident? Like, how did it happen? Well, nurse, I don't know. We were just having a good time. We were having party, and I was little drunk, to be honest. But then I don't remember anything afterwards. Well, okay, that's okay. I have recorded this information. Don't worry, doctor will take care of you. And as I am seeing you, I can obviously see that there is some swelling on your arm, which shows that you had a very bad time, and it can be a broken arm. I'm really afraid to tell you about this thing, but don't worry, doctor will come soon. He will recommend the investigation that is required. Well, nurse, where are my other friends? Well, in is this, I'm really sorry to tell you again that I don't know about your other friends. They must be fine. That is why they are not here in the emergency department, or otherwise they must be with doctors. So at this moment, I have been assigned duty to examine you, so I know only about you. I'm really sorry to say I don't know about other passengers in the car. But as soon as I record the vitals, I promise you I will go to the OPD and will ask about your other friends. Is that okay, Mr. John? Well, nurse, that's fine, but I really want to talk to my friends. I need my phone. Where is my phone? Well, Mr. John, I have no idea about your phone. Maybe that is kept in the OPD, as phone is not allowed in the emergency department as per the medical protocols. So, really sorry about that again. But don't worry. After 5 minutes, once doctor examines you, if you will be fine, absolutely fine, then we will take you out of the emergency department. If any treatment is required, then we will give you the immediate treatment. But for now, we can't hand over any phone to you, and also can't give you information about your friend. But just after 5 or 10 minutes, I would be able to provide you all the information. Would that be fine, Mr. John? Well, nurse, not really, but yeah, that's fine. I don't know. Now my arm is really aching. I don't know what to do. Don't worry. Let me examine you. Let me check your pulse and record other vitals, as doctor is coming very soon to you. And I have to take notes of your vitals so that I can hand over these notes to doctor. And only after going through these notes and after examining you, doctor will be able to reach to a diagnosis, or will be able to recommend you further suggestions like investigations, maybe an x-ray or something. Would that do? Can I examine you now? Well, yes, nurse. Okay. Well, thank you, Mr. John. And again, there is nothing to worry. We all are here. We have an expert team of doctors and nurses in this emergency department, and we will be taking care of you. And I reassure you, there is nothing to worry. And I'm just going to check I'm just going to record your vitals. We'll give this information to doctors, and he's also on his way. As there are many other patients, doctor is busy attending those patients, but he's coming very soon to you. By that time, I am here with you recording your vitals. So don't worry. Okay, Mr. John? Well, that's okay, nurse. Okay. It improves. It improves like anything. But when we are not talking in English, the flow is disturbed. It's all, again, that is why I always say in our lives, everything is about dedication, commitment, and positivity. And these things are interrelated. These are not different things. If you are positive, you will dedicate. If you are dedicated, you will remain positive. Action leads to thoughts. Thoughts lead to actions. That is how life works. Positive person take positive actions. After positive action, they get positive results. They become more positive. They again take positive action. That is how the sequence is repeated. So again, everything is a part of a process. And some people have kind of a mistaken scenario that maybe if I will talk in Hindi or Punjabi, I know English. No, 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 no. Fluency matters. And it comes with when you are in a flow. As you would be able to see this recording, the first time when I was speaking, I was little haywire. When the second time I was speaking, I was more fluent. So that is what happens when you are in the tandem. So please talk in English on your exam day. In the morning, when you are going before the exam, listen to something in English so that you can be prepared for your listening, as listening would be the first module that you will get. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you very much.